What does it mean if your orthopedic surgeon tells you that he's going to sew your meniscus tear back together? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education, insight, commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. In the last two videos in this series on sports and exercise injuries and surgeries, we've talked about meniscus tears. Again, that's the C-shaped shock-absorbing piece of cartilage between the femur or the thigh bone and the tibia or the shin bone. You have one on each side of each knee, and they're very often torn with twisting mechanisms or squatting mechanisms. And it can be really tricky. They can be very painful when you go to run or change directions, twist on your knee, or squat down. And very often those don't heal on their own. And so frequently we talk about surgery to treat the meniscus tear. The one we talked about last week was what we call a partial meniscectomy, where the surgeon goes in and uses scissors and a shaver to trim out the torn part of the meniscus, but you leave the rest of the meniscus in there to serve as a shock absorber. I recorded these and put them on YouTube. If you want to check that out, definitely subscribe to my YouTube channel. Go to the injuries and surgeries section and you'll see that. That's the more common of the two options for surgical treatment for a meniscus tear, is the trimming it out or the partial meniscectomy. I guess it's probably 85% of meniscus tears that's the treatment. About 15% of the time, and again, I'm just guessing, but that's roughly the breakdown. But a small percentage of the time, the surgeon can actually sew the meniscus back together. Now you may ask, well, why would he do one versus the other? And we'll talk about that, but let's talk about when the meniscus can be sewn back together. There's only certain types of meniscus tears that can be sewn back together. They have to be a certain orientation and they have to be in a certain location. So what we're talking about with orientation is it has to be a vertical or longitudinal tear that the stitches can just go across the tear and pull it together and hold it in place. If it's sort of a flap or it's torn in multiple directions, that doesn't work. The stitches won't hold it in place, and you can't do that. There's no reason to do that because you'll be coming back soon thereafter to trim it out because the repair didn't work. So the orientation of the tear matters. The location of the tear matters as well. And when we say location, we're talking about toward the rim of the meniscus, toward the capsular lining of the knee, not the free edge of the meniscus. And why that matters is that's where there's still somewhat of a blood supply, where blood vessels can get into the meniscus and basically help that repair heal. Toward the free edge, there's no blood supply, so even if you put stitches in there, very often it wouldn't work. Those are generally the two factors. And this is just as the experience of a sports medicine surgeon that's done hundreds of these surgeries. Very, very often the meniscus repair or meniscus tears that are repairable are found in high school, college athletes, and young adults, certainly 30 and under. It's not to say that it can't be possible to repair one in somebody in their 40s and 50s. I've seen that a few times, but just in the nature of how meniscus tears, how they're oriented, where they're located, the younger athletes, those tend to be repairable meniscuses, where repairable menisci, I should say, whereas people 40 and older, for sure, the vast majority of those undergo partial meniscectomy. Back to the question of how does a surgeon decide, it's really based on what the surgeon sees, what I see when I get in there. MRI has been shown over and over again to not be very good at predicting if a meniscus tear is going to be repairable or not. And we hope that it would be. That's why one of the reasons we order the test is to find out if you have a meniscus tear. But a lot of times you don't know going in. There are some things you can see on an MRI that would suggest it's repairable. If you hear the term bucket handle meniscus tear, where the meniscus tear, it's attached at the front horn and the back horn, but then it's sort of torn all the way within the substance of the meniscus, and the inner part flips back and forth on the posterior and anterior horns, and it can catch within the knee. If you see that on an MRI, you know that's potentially a repairable type of meniscus. But a lot of times you don't know. So a lot of times, especially in younger people, I'll warn the patient, hey, we're going to be prepared to do a repair if we find it's repairable, and we're going to trim it out if it's not. If the surgeon can repair it, that's a good thing, because if that meniscus repair heals, the chances of saving that entire meniscus and minimizing the chance for arthritis down the road goes way down. You want to preserve that shock absorber. So yes, it's a longer recovery for sure. You may be on crutches for a period of weeks, and they may limit your motion a little bit for a few weeks. Certainly it's going to slow you down getting back to jogging and getting back to sports. We're talking about a 3 to 6 month recovery compared to a much shorter recovery for a partial meniscectomy, but it's worth going through all that to save the meniscus shock absorber for years down the road. One of the challenges with the meniscus repair, and it's the last thing I'll get to because I know we've talked about a lot, there is, in the setting where you're just doing a meniscus tear and a meniscus repair, not an ACL surgery at the same time or some other surgery, but when it's just an isolated meniscal repair, we think there's somewhere around a 20% chance, maybe higher, that that meniscus repair doesn't heal. Despite the best surgeries and rehab, it's one of the tricks to meniscus tears, probably related somewhat to the blood supply of the meniscus, but that can be really challenging. It's just something you need to know going in, that over the next 3-4 months, 6 months, it might not heal, and then you might have to go in, the surgeon might have to go in and trim out the tear the second time. So that's a really tricky thing. We still try to repair it, it's still a good thing. That's just something that you want to know on the front end. Okay, have you had a meniscus tear? And specifically, did the surgeon go in and sew it back together with stitches and anchors? How did it go? Did it heal? How long were you out of activities? Were you non-weight bearing? Were you allowed to jog at a certain point? I would love to hear your experience, and I bet people all over the world would as well. So below this video in the comments, share your experience. I would love to hear it, and again, I bet other people would too. If you like this series of videos on injuries and surgeries in sports and exercise, I record these videos on a consistent weekly basis, and you can find them grouped as a category on my YouTube channel. So go to my YouTube channel, drdavidgeyer.com, click the subscribe button in the upper right corner of the page, and you'll get information on injuries and injury treatments and injury prevention delivered directly to you. Thank you so much for watching. I hope this video was helpful. Again, share your comments about repairing a meniscus if you've had one, and I look forward to seeing you right here next time.